Hi friends, I am presenting a case of hysteroscopy performed for retained products of conception. After a week of medical termination of pregnancy, ultrasonography showed heterogeneous mass and vascularity was in the type 2 variety where moderate amount of vascularity was present, which falls into the Gutenberg classification of type 2 RPOC, which needs removal hysteroscopically due to her persistent bleeding and incomplete evacuation. Diagnostic hysteroscopy was done just to see that mass was arising from the posterior wall and near to the fundus. Hysteroscope in a resectoscope, which is cold, means without the energy source, is passed inside the uterine cavity and it is just slightly dislodged from the posterior wall and made sure we are not used any energy source to separate the products of conception from the uterine cavity. Gently we are separating it from it and trying to take it out under vision so that there is a very minimal or no damage to the endometrium and complete evacuation of the retained products of conception. Since the vascularity was type 2, that means moderate amount of vascularity was present, we had already arranged for the energy source if it is necessary arises to stop the bleeding only at the bleeding points or after evacuation. If the bleeding persists, we would have continued with the Foley's bulb inflation. The resectoscope without activating energy source was sufficient to take all the products of conception. That was nearly a 3 into 2 centimeter, means 30 millimeter into 20 millimeter size was there, which was evacuated, and then check examination showed that there was small amount of chorionic tissue was present. The amount of bleeding was just mild to moderate type and uterine cavity pressure was kept nearly 90 to 100 millimeter water, so that the bleeding is also not significant and all the products of conception are evacuated completely. So this is a good way of evacuating the retained products of conception hysteroscopically, which produces very minimal damage to this. Usually, following a medical termination of pregnancy, after a week or two, if there is a persistent of increase in the thickness of the endometrium, if it is more than 15 millimeter, or ultrasonography showing a heterogeneous mass in the uterine cavity with a Doppler showing a vascularity, those patients needs evacuation to prevent the chance of infection, recurrent bleeding, and sometimes these patients will have a dysmenorrhea, and usually endometritis is associated along with these patients. So they need antibiotic coverage for a week of gram negative organisms, which will prevent the infection and adhesion formation in the future. So we can see that and check examination showed almost all the products have been completely evacuated and it was associated with very minimal bleeding that is performed. This is the mass that is removed after the evacuation.